Welcome to Practice Growth, the podcast that combines business and wellness to help you do your very best as a therapist. Get ready to learn from seasoned clinicians about self-care, therapy, and running a business. Now, here's your host, Stephen Quinlan.
Hello, everyone, and welcome to Practice Growth. Thank you so much for joining us today. Just wanted to take a quick second to acknowledge all of you and the fact that Practice Growth has just recently passed the 10,000 download mark, which is pretty amazing considering that I started this podcast just being to help as many therapists as I can, and it's really cool to see that there are people listening not only in the United States and in Canada, but hello to everybody in the UK and Australia, which also has had some pretty significant download numbers over there. So really cool to see, and just wanted to acknowledge all of you and thank you for sticking with us along this journey. And it is my sincere hope that this has been helpful to you in some way. So let's get to today's guest, who is Linda Russell, who is an LMFT based in California. Linda generously agreed to join us today and share her story, which is, I think, really a fascinating one for many reasons. One of which is, I think, how Linda has been able to take her own real life experiences and most notably tragedies and develop them into a passion for her work, which she has now translated into a passion for her fledgling private practice. So really interesting the ways that she's been able to blend this in, both in terms of her work with her clients, but also her own life and how those two things can intersect and be really valuable to everybody. I think it's also really interesting to hear from Linda about this subject of palliative care, which not everybody fully understands. And if you haven't had the experience of a loved one becoming ill or even being in a potentially painful or medical situation where they might need palliative care, you really probably don't have a whole lot of understanding of what it is. So I think it's a fascinating learning experience to find out more about it in general, and also hear about how Linda has been able to work this into her practice, as I was mentioning earlier. We are also so lucky to have Linda bring her joy and passion to the show, and it's really pretty evident how deeply she cares about the work that she's doing, and also how she is able to approach it from a place of spiritual profundity and also, interestingly, at the same time, a lightheartedness and a sense of humor, which, as we talk about in the show, I think are crucial to being able to continue to do what can be very difficult and demanding work. So don't forget to check out the website, growingthepractice.com, for all of the offerings that we have up there to hopefully help you and your business go to the next level as a therapist, but also be able to, as we talk about with Linda, to maintain where you are and to be able to continue to do this work that I hope means so much to you, and I know means so much to the people that you are serving. So let's get right to it, and welcome. Here is Linda Russell. Well, thank you so much for being here today. I am super excited to talk to you. I have to say, I think it's really early for you right now. Is that right?
You know what? It is 6:00, but I actually have been up since 4:30. That's my normal. So,
Oh, really?
Yeah.
Wow. Oh, good. Yeah. So you are an early riser.
Yes.
Love it. Good. So yeah, I want to talk to you about palliative care, because I know that that's kind of a passion area for you.
Yeah.
I'm also really interested in just kind of the the arc that your career has taken and this kind of place where you are now, and starting off on starting your own business and all the things that kind of come with that. So maybe let's just start there with what you're working on right now, what things are looking like for you in terms of your practice, and what you're enjoying about doing it right now.
Yeah, and I will say that my normal, my 9 to 5 or 8 to 5 is I work at in the medical system, John Muir Medical System here in California, and what I do by day is care coordinator, which is basically resourcing for patients, connecting patients to things that they need, to everything from coverage to transportation to connecting them with grief support groups. I mean, I do the gamut, which I really like. I love that kind of variety. And then I'm also part of the integrated behavioral health team, which means that we are embedded in the clinic. And we, if a resident comes to us, the facility where I work, the clinic where I work is a resident training program. And so if a resident comes to us, or even faculty comes to us and says, I have this patient, I'm concerned about their depression or their anxiety, can you come and talk to them? And so I might go in the room for 10, 15 minutes, check in with them, see what's going on. If there is an immediate intervention that I can offer them, sometimes like for anxiety, it might be a grounding exercise in the moment, in the exam room, while the resident is off talking to their supervising faculty. I might do that, or I might call the patient and set up, more visits. But the idea is to really look at whole person care. And that is key. That is really crucial. The idea of looking at people beyond their medical, their immediate medical needs, but really looking at what else is going on for this person. And I will say, just for me personally, I also carry a spiritual lens. Not that I do any kind of spiritual counseling, but I mean, I am looking at how is what this person's experiencing, how is this impacting them, mind, body, and spirit.
I would only imagine in that kind of work and, in doing that, especially the palliative care, that would be part of the picture. So I can't say I'm completely surprised with that.
Yeah.
So it sounds like a lot of what, as you're saying, in your sort of day job is helping essentially residents, so physicians, right, understand things from that more kind of holistic perspective.
Mm-hmm.
Okay.
And then one of the other things that I do is I teach the residents how to have palliative care conversations. It is really important. And I'll step back a minute and tell you how I came into this. Okay. So several years ago, actually 16 years ago, I lost my husband to cancer.
Oh, I'm sorry.
And at the time, I was working in another clinic setting. I was with the county here in HIV services. And so I was working with folks who were dealing every day with their concerns around their mortality. And then I went through this experience with my husband. And it was important to me to really bring this experience to the work I do, because at the time, unfortunately, even though we had really good docs, we had a lot of really good medical care, not everybody knows how to talk to families and patients when they are going through this experience. And the one constant support was our family practice doctor and his medical assistant. And so after, it was interesting because literally within weeks after he died, I came across a journal article on I was a medical social worker at the time. And I came across a journal article on palliative care social work. And I thought, oh my, I could have used that. What is that? And so I started reading on it and did a lot of reading on it. And then, as so often has happened in my career, I shift from doing HIV services to working inpatient at the county hospital. Just so happened that they were just getting ready to start a palliative care rotation, consult service, actually. And someone asked me if I would be interested. And I jumped on it. I thought, yeah, this is meant.
I was going to say, it almost feels like you don't have a choice at that point. This is sort of being handed to you on a platter.
It was just the idea of, for me, the thing is the idea of coming in and talking to people about making decisions, about what they're experiencing, about who is around them to support them, is huge. And because of my own experience, I just found that I was comfortable as both as a therapist, but also as someone who had had the experience, and did that. I did that I was part of the consult team for over 5 years. And so when I moved from that clinic, that hospital setting, and I was also in oncology, and I was doing a lot of the work with oncology patients. One of the things I need to say is palliative care is not just, everybody thinks of it so often and associates it with end of life and hospice. And there's so much more to palliative care. There is so much more. When you get a diagnosis, even if it's not a terminal diagnosis, but it is going to change the trajectory of your medical care, your life, your relationships, those are the kind of situations that palliative care can really step in and address. And those are the conversations that often are not had. And so for me, the idea of teaching medical residents how to have those conversations and how to do it in snippets. You have somebody that was in the hospital, they come out, they had kind of mixed experiences. They in hindsight, they might have done this, they might not have done that. To be able to have those conversations, I think, is so critical to, and it allows patients an opportunity to reflect, but it also allows them a chance to really, talk about what is important for them, what's meaningful for them, what they would want if they are hospitalized again, what they don't want. But it's really delving into the conversation about what is meaningful for that person's life. And it's not something that we always look at in medical, and certainly, in a 15 or a 20-minute visit, the physician is very focused on what's happening here and now.
Right.
But I always encourage them, when you have that opportunity, just ask one or two questions, what's important to them, who supports them, so that you can get to know them so that if you're ever in a situation where the big conversations or the challenging conversations need to happen, you have you have more information and more understanding about who that patient is.
Yeah. I love that your work is paralleling your life experience, because I just think there's so much value in that. As you were saying, you understand this on a individual emotional level. You've been there, you've done that. You're able to help clients in a way that is different because of that. Like you bring that to the table. I just think that's so valuable beyond, I mean, the obvious amazing work that you're doing, that I think, as people, we shy away from death because it's uncomfortable and people don't necessarily want to talk about it. But so much is missed when you don't do that. So this is kind of your day job, as you said. Tell me about this budding business that you have happening, and what is that exactly?
So right now, I am just starting off slowly with taking on individual clients.
Mm-hmm.
My plan, though, is one of the things that is important to me is to, and I'm actually currently kind of thinking about how do I want to do this,
Mm-hmm.
but I do want to have a platform and a way to talk more about palliative conversations. One of the things that I have really thought about that I'd like to do is to have maybe, might be a podcast
Mm-hmm.
or some way of having conversation opportunities for people to, ask questions, and the focus would be having these hard conversations.
Mm.
So that's kind of where I am.
Mm. Okay.
My individual clients are more, or the work that I'm doing currently with my clients is more family or individual focused around depression and family issues.
Okay.
Because that's always my go-to. That's kind of my base.
Uh-huh.
I was trained as a family therapist. And
Okay.
so that to me, and that's another thing that I bring to the palliative, because so often we just look at, and that was my experience, where people just look at the patient
Uh-huh.
and they're asking the patient things, but they're not seeing that the patient is part of this system,
Mm.
and that this system is going to, how does the system respond and support what this patient is going through? And so that's another reason why I am working on creating this this space for conversation
Mm.
around this.
That's such a great idea, and I think so needed for people to be able to address this stuff and understand the whole picture. I feel like that's a lot of your mission, is just sort of understanding what is it and what is palliative care, and how can people go into what might be a really difficult situation armed with this knowledge of, here's how we're going to help this client, here's how we're going to help them to feel dignified and heard and understood. And it's so difficult, as you were saying earlier, within the context of our current medical system, where everything is like this boom, 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 drive through kind of, I mean, these poor doctors, they only have 15 minutes and it's like, they're off to the races again. And it's just so unfortunate that so much is missed there on a human level. So
Mhm.
there's so much need there. I think that sounds like a wonderful idea. Are your current practice clients, are they mostly people who are having issues kind of around maybe illnesses or palliative care issues, or is it just kind of separate from that?
Not right now. Not
Uh-huh.
right now. as I said, I do a lot of that teaching, having those conversations with the residents that I work with.
Mm.
The other thing that I will add that I think is really, really important, and so often people do a double take when I see this, but the other thing that is important in having these really challenging conversations is laughter.
Yeah. Uh-huh.
It used to give me I used to get such a kick out of coming out of, say, a hospital room when we had a really, deep conversation about, something major that is happening, the cancer medication has stopped working,
Mm.
or something that is really impacting the patient and the family, or their chosen family, whatever that looks like. And I would come out and the nurses would look at me and say, I thought that was a palliative conversation. And I'd say, oh, it was.
Guess you're having a party in there.
They're just laughing. And it's
Yeah.
like, oh my gosh, yes.
Uh,
Yes.
yeah.
And that is one of the things, because I think what gets lost when we think about these challenging conversations is, in all of that humanity, is who is this person? If the focus becomes the illness,
Mm-hmm.
then it is very easy to go down that rabbit hole of pure despair
Mm-hmm.
and upset and all of those negative emotions. But if that, just when I see that happening, I see the person getting smaller and smaller,
Mm.
because we're not acknowledging all of who they are. And I always want to talk about what's important to you, what are the things that you like, what are the things that you want to do, what are your hopes,
Mm-hmm.
so to open that conversation,
Mm.
and to really, not only for the person, but for the people around the person, to be able to see them, in all of their humanity.
Yeah.
And that is again, that's me feeling it from a place of, from a therapeutic place, but also from a spiritual place.
Mm. Yeah. Well, I would imagine that there's so much of that that transfers over into your work in terms of your practice, that you're able to take these lessons of not necessarily focusing on it's essentially pathologizing, really, when it comes down to it, right?
Yeah.
Like you're just seeing kind of the symptoms, and you're not getting that more kind of gestalt of the whole person and the system. So I imagine it's very valuable for you. How did you come to this place of that you decided, because you've been doing this work for a long time,
Mhm.
and how did you get to this place of, you know what, I want to do something else, I want to do or bring this stuff, this knowledge that I've got into your side kind of practice? How did that come about? Take me through that.
Well, I think it is, one, recognizing that I love the work.
Hmm.
It is really near and dear to me. And seeing how it transforms patients, clients, seeing how, when it is done well, how, the impact that it can make. And one of the things that is a challenge is that, even though palliative care has, a lot, much more press, if you will, these days, it's still widely misunderstood. It is still, I think, underestimated and underutilized. If you're only, suggesting palliative care to someone at end of life, you're missing a whole big chunk. And the other piece is, the thing that ways that I've interacted with folks is that, when people hear the word palliative, they freak out.
Yeah.
because it's this assumption because of that connection with hospice.
Hospice. Yeah.
It's like, no, we're not there yet. We're not there yet. And
Right.
so I find myself doing often trying to sell palliative care.
Mm.
And this is a big reason why I thought, okay, I need to, you know, do some more on just getting out the word on what this really is, because there are so many people who could really benefit from this who don't, because they hear the word and they say, oh no, we don't want that, we're not there yet. And it's like, okay, I'll give you an example. I had I was talking to the relative of a patient. I had been recommended to talk to her, ask about, a consult, and she was angry. She was really angry. She felt it was an affront. She felt it was, you're giving up on him. And in that moment, in that conversation, she didn't want to hear, I thought, oh, if I could just get that, that elevator message, if
Yeah.
just, but in the moment, I could tell she was pretty angry, and she was not open to it. She called me maybe 2 or 3 months later and wanted to have a different conversation, and said, I realized I didn't give you a chance. And she said, but I didn't understand what palliative was. Conversations like that are the reason why I really want to expand awareness. And I want to encourage people to ask for palliative care. I had a friend who recently went through a situation where, and they're in another state, family is in another state. And she was describing the situation to me, and I said, how about your family ask for a palliative conversation? And she said, I was thinking about that, but I don't know, you bring up palliative, and I said, yeah. So I actually gave her some things to put out to her family to make it seem less scary, more informative, and really consider it as a service that really focuses on making folks comfortable. Even while they're going through active medical interventions. People don't think about that. It's like, if you can have palliative care and have your pain, your nausea, your shortness of breath, have that addressed, be more comfortable, go throughout your life, literally, and go through treatment. So that's a big reason why I really want to expand this conversation. And it is, I would say it is, to me, it is, palliative care is a secret that should not be kept. I was going to say a well-kept secret, but it's like, no, but it's a secret that really shouldn't be kept.
It's like a misunderstood secret that people are missing out on the service that is there. That, because when I hear palliative, I think of, and my first experience was, when I lost my dad 12 years ago, that was really the first time I heard that word even. And I was like, what is that? And I had to understand that really, essentially, that just means making somebody comfortable. But the association is, as you said, to hospice and end of life, so that people have this really visceral reaction to that, because what you might be in some way saying is like, this is it kind of for your loved one here. And so then you've got denial and all of those things that kind of come up. So for you, this is really, I'm getting the sense that this is a mission of understanding or misunderstanding, should we say, and getting that information out there so that people who might be going through something difficult on a medical level
Yeah.
can get this care which is available to them.
Yeah.
Mm.
Yeah, absolutely. There is a series that happens. It happens here in San Francisco. It's a series of events that happen around the city, and it's now kind of spilled over into the East Bay, which is nice, called Reimagine. It's also happening. There's also a Reimagine New York. And I think it's in maybe a couple of other places, but the whole focus of the events and the whole idea of Reimagine is literally reimagining illness and death.
What does that mean?
Huh?
So what does that mean? Like sort of
So,
reconceptualizing the whole idea, or what does that mean?
well, demystifying,
Okay.
talking about it. I think that's one of the biggest things, and that's where my work comes in, because it's the idea of even talking about
Okay. Mm-hmm.
some of these, having the conversations. And when I say there are these events, I mean literally there are usually 2 to 3 months worth of events that are everything from, yes, death and dying, but also dealing with laughter, dealing with looking at the whole person, recognizing how we look at death, how we talk about it, how we look at illness, because again, I expand it to, illness.
Right.
And the idea of really looking at how we even have conversations, when my husband had, when we got the diagnosis of cancer, a lot of conversations stopped because people didn't know how to talk to him about it, and didn't know how to how to approach. And I've seen that as well, is the impact that it has when someone has an illness and people don't know what to do. So people will literally lose their social connections because folks aren't sure of what to say. One of the things I think that can happen to have an expanded conversation about palliative care, but also about, just how do you keep having conversation even when there's something big going on, there is something that is impacting this person, but how do you continue to be a friend, be a lover, be a child, be a parent, when there's this thing that is happening that people, that we're not necessarily sure, how is this going to go? Where is this going to go? But the bottom line is, how do we keep going, and how do we continue quality of life, regardless?
So much of what you're talking about, I feel like, comes down to this thing that we know on a broader level psychologically, which is that going into things that are difficult and not necessarily shying away from them, be that, anxiety is certainly a good example of that, right? All these avoidance things that happen by trying to go around things, it's like you miss out on all this other stuff that you're saying. I mean, you might miss out on a service in palliative care, which could be very helpful for you, but you also might miss out on the laughter and all those other things that you're describing, which are sometimes born out of this dark place, like a dark humor. As being Irish myself, this is something that is a kind of part of the culture, that people make these sort of dark jokes, which, if you really look at them, I guess literally in some sense, you're like, well, that's kind of horrible. But then in certain circumstances, there's so much laughter that comes out of that. And it's sort of like born of an acknowledgement of what's actually happening, rather than trying to dance your way around it.
So I have to share this story
Yeah.
because this was when I was working in the hospital, and I went in to talk to a woman who she was in her 80s. She had just been given a diagnosis of breast cancer, and she said, you know what? I don't want treatment. I
Yeah.
don't want to spend whatever time I have, in the hospital
Hmm.
and on chemo and going through all of this. So I go in to talk to her. She was delightful, and she was very clear. I don't want treatment. And so she said, please tell people I'm okay, that I don't want. And I said, oh, I get it. I get it. So while we're talking, she said, now she had a roommate. And I could see the roommate. She was looking at me. She didn't see the roommate, but I could see her roommate. And the patient looked at me and she said, my brother has been gone for many years. And I said, oh, okay. And she said, but he came to me last night.
Hmm.
The roommate turned around
This ought to be interesting.
and me like, oh my God. And I said, okay. I said, how was that? And she said, well, she said, it was a little unnerving, but she said he came to me and he told me I'm next. Now the roommate is like sitting up in the bed.
Uh-huh.
I said, huh. I said, well, how do you feel about that? And she said, well, I'm not really. She said, I'm glad to know he's there. I really would, I'm hoping it's not my time yet. But she said, if it is, as long as I don't have to spend it, with, listening to beeping and hooked up to stuff,
Yeah.
she said, I'm okay with it. Her roommate was just, so I looked at my patient and I said, it was around the holidays. I'll never forget. It was Thanksgiving. And I said, what is your biggest wish right now? And she said, I want to be home with my family at Thanksgiving.
Mm-hmm.
And I said, okay, I will make that happen. Her roommate looked so relieved.
Yeah. This lady's talking to people that aren't even here. You got to get her out of here.
And I came out and I was cracking up. But also for this patient, it was this thing of, I have agency. I am very clear what I want. And that's another thing, is acknowledging the agency of folks in terms of making their decisions. It's also one of the reasons I frequently talk to people about their advance directives, like you decide what you want, what you don't want, and then choose people who get it. Even if they don't totally agree, people that can support you in what you may or may not want. The big piece is that agency, that sense of really connecting with someone to say, what is important to you, what is scary to you, let's address what's scary. Let's talk about what is maybe unnerving. Let's put a plan together for next steps. There's a lot that you can do when you're willing to have the conversation.
I can't imagine doing this kind of work that you're doing and having it not obviously affect you in some way. So I'm wondering, how has doing this work and helping people with their agency and with having that sense of control and understanding what's important to them in their life, how has that affected you? Have you felt like you've had to be more clear on defining that for yourself?
That's a great question. Yeah, I think a big answer to that, or a big way to answer that, is to, when I remember what my experience was like,
with your
to,
husband.
yeah,
Mm-hmm.
and to not have someone who was willing to, like I said, we were seeing specialists. They would ask him, how are you doing?
Mm-hmm.
And he would say, I'm okay, and they would say, so who supports you? And he would always point to me. And then when they found
Good
out,
answer.
and then when they would find out I was a therapist, they were like, oh my gosh, that's great. And
You're
it's
all
like,
set.
nobody is anybody like asking
Yeah.
how am I?
Right. What about you? Yeah.
And so for me, it is that self-care. There are, I always tell people the ocean is my sanctuary. So
Mm-hmm.
I'm so grateful. I'm just about an hour and a half away from the ocean.
Mm-hmm.
Because that is where I need to go sometimes, just to reflect and also to look at something. I love looking at something that has been here for millions of years, will
Mm-hmm.
be here long after I'm gone, and always looks the same.
Mm-hmm.
And just the waves coming in and out. I can sit there for hours, and that is my ultimate self-care.
Mm-hmm.
But it is stepping out and recognizing when something hits, when there is a situation that is challenging for me, I will definitely step back, get some support around it.
Mm-hmm.
If it is something that one of the patients I worked with shortly after my husband died,
Mm-hmm.
he was hospitalized, and he had met my husband just briefly. And I thought, okay, am I going to tell people about, and I thought, no, I'm not ready for that.
Yeah.
So I didn't say anything. And he had been in and out of the hospital a couple of times. And one day I was on my way out the door, and he said, so he called my husband Doc for some reason. How's Doc? And I said, excuse me? And he said, yeah. He said, your husband, how's he doing? And I said, oh, he actually passed away about 6 weeks ago. And he said, and he kind of, he wasn't sure of what to say. He said, I'm so sorry. And then he said, so you know what I'm going through? And I said, no, I know what your wife is going through. And so that to me is that stands out to me as one of the things I try to bring into the conversations, is that acknowledgement that, and that's where, even though I know I wear a pretty strong clinical hat, I think it is equally important to bring heart. Sure. And I think that is also when you can really bring in the art of doing therapy and sitting with folks, of just really seeing people and just kind of opening them up. And I try to do that from a place of, this is what, and I always ask, if this is, if I am going places where people want to go. But one of the things to me that's important, and that I do for them and for me, is to allow myself to be a part of this person's story, at least, for these few minutes or hour, however long I'm with them.
Well, it's beautiful. I certainly salute you and the work that you're doing. And I think that I'm glad to hear that you have ways of sort of, obviously taking care of yourself as well, because I think that while there's the value of bringing your own life experience, which I assume you kind of have no problem bringing into the fold at this point, there's also things for us that get stirred up by doing that. And so you have to, it's like this very powerful thing that, and wonderful that you can use, but at the same time, I think you also have to be sort of judicious about, okay, if now that I've, that was really intense and that kind of kicked up some things for me, how am I going to manage myself so that I can continue doing this for folks?
And sometimes it might be, there is a, sometimes it might be just going to a park.
Sure. Yeah. It doesn't have to be some big,
Looking at nature. Yeah. For
right.
me, though, the looking at nature in
Mm,
some form, that's my healing place. That's the place where I just go and listen and breathe.
mm.
And yeah, that's my ultimate self-care.
Yeah, I'm with you. And it's such a great point that I think sometimes people hear self-care and they think, oh, great, well, now I have to sign up for this week-long workshop, or now now I now I have to go off, to a cave in the mountains and meditate for 5 hours. And it'd be so simple and just intentional to, I'm just gonna take, 5 minutes sometimes. Maybe
Exactly.
you're in
And
between
I think,
clients.
and that's a really good point, because that so often, and I always tell people, I don't know if it's my ADD or what, but 5 minutes and can be a game changer for me.
Yeah.
And so sometimes it is going in and, thinking about the conversation and kind of, maybe it's making a cup of tea or a cup of coffee, and just, I think the biggest thing is to acknowledge
Mm.
this was hard.
Yeah. Right.
And I
Right.
will do that. I
Mm,
will, someone will say, oh, how'd it go? This was hard,
mm,
you know,
yeah.
as opposed to just going kind of next thing, next thing, next thing, and not really acknowledging the impact that this
Yeah.
had.
It's very similar to what we were saying earlier about denying what's happening right in front of you, with maybe that somebody needs palliative care.
Yeah.
Uh, and that so much difficulty comes out of that, rather than just sort of acknowledging what the truth is.
Mhm.
And then you can go from there. And
Yeah.
there's all the support available to you, but you have to say, this is happening.
Yes.
It's
Yeah.
almost like a kid who needs an autism diagnosis or something like that, so that
Right.
they can get services. Like,
Right.
if you haven't said this is what's going on, then the support isn't there for you.
Yeah, and I would say too, just in what you were saying, the thing that I experience, whether it's me stepping off saying, wow, that was hard, or the family, the patient acknowledging, the thing that always amazes me is the exhale.
Uh-huh.
Literally the exhale when you have a difficult conversation, and especially when there were many, many reasons not to have it,
Mm-hmm.
and then folks decide, okay, fine, all right. But then when they have it and they realize, wow, okay, I needed that. I didn't
Mm.
know I needed
Yeah.
it,
Yeah.
but
Yeah.
I needed it. And I walk away, even when it's, I know that I'm getting ready to go through chemo, or I'm getting ready to have this surgery. Even though it's big, it feels, that exhale helps
Uh-huh.
it feel less overwhelming.
Yeah. Yeah. What would you say to yourself, that former version of yourself, who your husband is sick and you are having to go through all of these things, knowing what you know now? What would you want yourself to know at that point?
Mm. That I was going to take that experience and help other people.
Mm, yeah. Yeah. I
Yeah.
love it.
Because when you're going through it, it is, you're very much in this bubble. And it's the bubble of the day to day. It's the bubble of what needs to happen. It's appointments. It's all of the stuff. And I always ask why, not in a sense of why me, not at all, but in a sense of, okay, what am I supposed to get out of this? And so when I think back what I would, the answer to that question when I was going through that would have been, I am going to use this experience to support and help other folks.
Yeah, that's beautiful. And I think in the spirit of a lot of what we're talking about, and just kind of this podcast in general, that like you have taken this thing that happened to you and you've developed it into this beautiful thing that you're able to offer to other people. And I'm sure that for you going forward and whatever that looks like for you, kind of creating this space to have people be able to talk about these things that are difficult and understand it in a new way, I think that will just be invaluable for you. And I'm sure that that will be very helpful to a lot of people.
Yeah. I am looking forward to, even just having this conversation, it is, it helps me to really look at how do I, expand this and move it forward. I've had ideas, but I am definitely looking at, again, what does it look like? What will it look like?
Yeah, and it's tough as therapists, that we get these ideas sometimes and we're not really sure how we want to implement them. I've definitely been there. We don't have MBAs, we're not business people, but yet in order to get out this message that's so important that you're talking about, you have to sort of dip your foot into that somewhat and be like, all right, well, how am I gonna do this? But I think your message and your experience, both personally and also in terms of just kind of your vast clinical career, which is, I think, it's 20 plus years, right? So there's so much knowledge there, and and obviously the need is there. So I'm sure that will go well for you, and I wish you the best of luck with that going forward.
Oh, thank you so much. And this was a wonderful conversation.
All right, that was Linda Russell. Thanks again to Linda for joining us today, and certainly to her for all of the work that she is doing to try to help all of those families and clients who are in need. Also, don't forget to check out the website, growingthepractice.com, where you can get your 5 free tips to help you as a therapist avoid burnout and keep doing what you're doing. So that is it for today. And as always, be well and be in touch.
This podcast is not intended as medical or psychological treatment. In no way should it replace treatment from a mental health professional.